Great. And yeah, just let everyone know we're just gonna record this so we can help others in the future if anyone has any questions, and we'll make sure for those who would like, of course, we'll send over the recording of it so you can review it at your own leisure. I guess we'll get going. Hello, everyone. My name is Dr. Matthew Perry. I'm a physical therapist, owner and operator of Auto-Ness Physical Therapy. For those of you who don't know, Mercedes, I'll let you introduce yourself.
Hi, everybody. I'm Dr. Mercedes Cook. I specialize in the upper cervical spine. We do something called the Blair technique, a little bit different than traditional chiropractic. So we do specialized imaging and work with a lot more complicated head and neck cases than just your traditional chiropractor. I met Matthew a couple years ago, and he is phenomenal PT, and we really bonded and have a huge heart for really helping our patients as much as possible. So I'm excited to be here with you, Dr. Perry, and kind of give our patients some more tips on how they can help with their wrist issues.
Yes, absolutely. And, a testimonial to Dr. Cook. Dr. Cook's tremendously helped my wife with her neck, kind of shoulder nerve pain, which actually we'll talk a little bit about today. We actually have a few clients that we've collaborated with in order to best help them who are actually on this call. So that's wonderful. All about helping. So yes, welcome everybody to the wrist workshop. Okay, we're gonna first talk a little bit about the wrist and a little bit of the complexity of it, and then we're going to talk about what we can do to help fix some of these issues. So if everyone can see my screen, this is hand and wrist anatomy. There's a lot of things going on here, right? It is an incredibly complex system. Just real quick, we have the kind of back view. They call it the dorsal view. Have a lot of ligaments, and this is not even showing all the muscles, all the nerves, all the other things. This is just really bones and ligaments, and it's already very complex. We have a lot of, I'm trying to find it, our retinaculum, extensor retinaculum, if everyone can see my cursor. And we also have a flexor retinaculum, which is on the other side. And we're going to be talking a little bit about that because who here has heard of the term carpal tunnel syndrome? You can either raise a hand, you can throw it in the chat, please feel free. You can also do a little raise hand button on the, okay, yeah. So most of us have, absolutely. It is a very pervasive condition that does affect the wrist. But we're going to talk about other ways that can present as a carpal tunnel syndrome, but actually someone on here, I was actually just diagnosed. So yeah, it's a very, very common condition. And so hopefully it's not too blurry on your end. And we have the transverse carpal ligament over here. And we have this median nerve, if everyone can see my cursor. The median nerve is the common most entrapped nerve that does present in carpal tunnel syndrome. And on this right side, we have a compressed median nerve under that carpal ligament and or flexor retinaculum. They're pretty interchangeable. Okay, and so what's happening is it's actually being pressed and compressed. How does that happen? Lots of desk work. There's a lot of other ways that can compress the carpal tunnel intimately. Lots of heavy weights in extended or flexed positions can cause the carpal tunnel syndrome. Also posture, which we'll talk about a little bit later. And so that median nerve gets compressed and you end up having symptoms into the hands. I'd like everyone in, of course, a pain-free range to do some self-testing on their own flexor retinaculum. We're going to start with this left image. What you're doing is just with a neutral hand. You can do it up here or down here, however it looks. We're going to actually, with 1 or 2 fingers, tap in that area. Typically, if it's a true carpal tunnel, what you're going to feel is a little bit of sensation down here. What we're doing is we're actually kind of interrupting that nerve signal. Another way we can do that through testing is the palms of my hands are facing out. We're going to do this. And you're just going to raise your hands, not your elbows. And what that's also going to do is compress on that carpal tunnel syndrome. It's not one of our best tests. I think the first one is a little bit better. But if you have some symptoms into your hands with that, that could be also a positive finding. The alternative is doing this like you're praying and lift the elbows. It's another way to do that. Anyone have any sensations? Yeah, few people. Yeah. And so again, that's interrupting that that nerve flow going into the hands. And of course, this could be on one side. It could be on both hands. You could have none of these and still have carpal tunnel. You can, and then the vice versa with that. You can have some false positives with it. But these are some of our rudimentary tests. So what symptoms would you experience if you didn't just experience any symptoms? Mild carpal tunnel, we're talking about sensory deficits only, okay? So just kind of some maybe numbness, tingling, things like that going into the hand of the affected hand. But as we get more moderate, we're starting to have more motor issues, sensory and motor. So you have that numbness, tingling, things like that. You might find it might be hard to grip something, particularly if it has a little bit of weight. A lot of our clients might have some issues with dropping things. Oh, I just dropped stuff out of nowhere. You know, if you've been clumsy your whole life, that's, you know, a different story why you might be dropping things. But yeah, you might have some motor issues as well. And then severe, you have sensory, motor, but also this word atrophy to the thenar muscles. That's here. These muscles in here are where your median nerve goes to. And it might look a little sunken in only severe cases. Hopefully, we're all proactive people here and taking care of it before it gets to that severe case. Okay. Any questions so far? I'll wait if anyone has anything in the chat. I don't think I see any hands raised. Okay, cool. I'm glad this is
so good.
So far, so good. Great. You know, I really want this to be informal and informative to you all. Okay, so we just got a message in the chat. What does the sunken look like? Great question. So I obviously don't have it sunk in here, but if you can look almost like an indentation as if you were pressing here in your thenar area of your wrist, of your hand, sorry, but obviously while not pressing. You see how there's a lot of muscle bulk in here? This would start kind of going away if you had some severe carpal tunnel issues. So, you know, it's going to look different for everybody. I work with my hands all day, so does Dr. Cook. But again, it's that sunken. It's pretty noticeable actually when it happens. It's a great question, and hopefully, Mona, that answered your question. Wonderful. What do you do next? Well, we've identified some carpal tunnel going on. So current evidence is still suggesting nerve mobilizations. Okay, they call it nerve flossing, neural flossing, nerve tensioners. There's a million different terms for that. But really what that is it's getting this entrapped area a little bit of room to breathe, if you will. Okay. Think of your nerves as spaghetti, a piece of spaghetti within sauce. Okay. When we do a nerve mobilization, we are kind of from each end wiggling that piece of spaghetti out of that sauce. Okay. And just like muscles, just like nearly every other tissue, we need to make sure we're stretching. Okay. And in this case, it's stretching the nerve. So I'm going to show everyone that. Okay. So we're going to start like this. Okay. Again, everyone, please do this within a pain-free range. We have not evaluated you and don't necessarily know what's going on with you. If you feel some symptoms, maybe don't perform this. But we'll be like this, and I'm going to scoot over so you can see my whole hand. And we're going to come out like this. Okay. And then we're going to come in, and then we're going to come out like so. You can add some things to it, such as I'll start in, as you come out, you might turn your neck towards that side and then come in like this. And what some of you might feel, whether you have a true carpal tunnel or not, is maybe a little bit of tingling in here, coming all the way through into your fingertips. I sure do. I have some neural tension that I need to continue working on. Okay. Some other things you can do to kind of play with it is decrease with your hand that angle and then go back into it. Okay. You can also hold here, do this.
Yeah.
There's a lot of different ways you can do
Yes.
it. So does that make sense, everyone? Yeah. Okay. The next step of that is you can then tension it by going the opposite direction. Okay, so as you go out like this and then in like this, and we call these tensioners. Wouldn't really recommend those until you get the other ones down, but that's always an option as well. Am I making sense, everyone?
Yes.
Everyone tracking? Okay. I know it's kind of a weird position, but it's a great way to make sure the nerves stay healthy. Whether you have carpal tunnel or not, we could all be doing this. But my question for y'all is, what happens if it's not coming from the wrist? What's happening if you have some of these, numbness, tingling, maybe even weakness going into your hand? But this guy was negative, this stuff is negative, and maybe this stuff is not provocative at all. And that's where I'm going to put Dr. Cook on the spot to, talk about from her practice as an upper cervical chiropractor for those who are joining, specialized upper cervical chiropractor. What other things could be going on?
Yeah, so I want to show you guys, I have a trusty little model here of the neck, because a lot of times when we have injury or a pain or sensation somewhere, we just sort of think like, okay, well, my wrist is the problem. And one thing that we see often in our practice is patients who are either diagnosed with carpal tunnel or just told like, oh, it might be carpal tunnel, we don't really know, but something's going on with your wrist because you're having pain or numbness and tingling, weakness. And one thing that is often not paid attention to enough is just what is going on in the neck, because let me kind of show you guys. This is our neck from the front, and we have something up here called our brain stem. So all of our nerves are stemming from the very top. They come down the back here, our spinal cord forms, and then we have all these fun little nerves that are shooting out from the sides. And The cool thing is that each nerve is responsible for its own job, so it goes down into its place. And just so you guys know, the first 3 cervical nerves, 1, 2, and 3, those are going to kind of help with your neck movements, your facial sensations, and things like that. Your C4 is going to help with some shoulder motion and your diaphragm. So think breathing. And then C5, that one's going to start to go down into your arm and your elbow. And then C6 is kind of like Dr. Perry was talking about, that thumb. That's going to go into the thumb and into the forearm and the wrist muscles. And then C7, C8, those are going to go. So think like C6 here, C7 is here in your middle finger, and then C8 is over here along the pinky side. So a lot of times we'll experience numbness, tingling, and pain or weakness solely just because there's an issue in the neck. Maybe there wasn't really an injury in the wrist. We didn't fall on it. Nothing happened. So we have to look at where these nerves originate, and that is up here in the neck. So that's kind of where I come in. We do 3D imaging and kind of assess, well, have you lost curvature? Is there imbalance in the spine that actually may be contributing to these symptoms? So that's why it's great to always, of course, check in with your PT and get your actual wrist assessed properly. And then also getting your neck checked by someone who's properly trained to do imaging and see if it's actually more of just a nerve issue up at the top. So it's just another perspective of if you tried to heal from, wrist or hand related issues and it's not improving. Sometimes just looking at your neck to get a different perspective can be very helpful. Did that make sense?
Yes.
Cool.
Yeah, very, very well put, very well said. That's the really interesting and tricky thing with the particularly the wrist shoulder complex is you can have this I like to call it a kinked fire hose. That's the nerve that has an interrupted signal maybe presenting down here, but that kinked hose or kinked fire hose could be coming from up here, as Dr. Cook was saying. So there are also a lot of other different sites of entrapment, and current research is saying up to I think it's about 9 sites of entrapment along where you have that kinked fire hose that can manifest as that carpal tunnel. And we always recommend that before going under the knife, because typically, no offense to surgeons, but say, oh yeah, you have carpal tunnel, I'll get you in next week and we'll cut it, right? I know a lot of you have heard that in some aspects with your body, but maybe get a second opinion, second pair of eyes on you, just to make sure that what they're cutting is what they're actually cutting. For those who have been diagnosed with maybe carpal tunnel syndrome, as at least one person here has, another second opinion could be a nerve conduction study, right? Where they kind of probe the nerves and see where the signal's interrupted, because you can always have surgery later on, but it's pretty hard to undo surgery once you've already had it, right? Circling back on some of the things that can be done in the neck, there's also postural stuff, right? A lot of us, including myself sometimes, admittedly, assume too much of this position, the forward head, rounded shoulders, okay? You can all say, no, that's not me, I have perfect posture. But you'd probably be lying, because none of us have perfect posture. Okay, and so we need to make sure that we're bringing ourselves up like this to make sure we're not occluding those nerves up here, giving the nerves, again, I like the analogy of giving them some room to breathe, okay? Opening some of that up, but that's not always the solution to it. And Dr. Cook, I'm sure you see in your practice, all the time, things are happening in the upper cervical area that might be contorted or twisted, in a certain way that that could present, as all kinds of other things, right?
Absolutely. Yeah.
Yeah. But a quick postural thing, which I'll definitely leave everyone with, is I'm giving everyone a side profile. Okay. I want you all to, my hands are down here, rotate your arms out, pinch your shoulder blades like you're trying to pinch your shirt or sweater in your shoulder blades. Okay. I'll get up a little bit so everyone can see. Here. Okay. That's starting to work on some of those postural muscles to keep you a little bit more upright, because most of our parents have told us to stop slouching for most of our lives. How did that work? Probably not very well. We have to do some things to kind of bring you up into a more upright position, so that you're giving your nerves the best chance to thrive. Does that make sense, everybody?
Yes.
Yes. Great. Yeah. And does anyone have any questions surrounding this, surrounding other things that might be coming from the neck that either myself or Dr. Cook can try to answer?
Well, one thing I wanted to ask you about the carpal tunnel is there any link to it coming from like the elbow?
Yes, absolutely. It's a great question, Craig. And so, the nerves, as Dr. Cook was saying, that C5 through C8, those nerves have to come all the way down here, right? We don't have Bluetooth in our body, so they have to travel. And places in the elbow absolutely can be places of entrapment. I know for a lot of our clients, it can be here, right in this elbow crease. Some of those areas, and then also some of these muscles in here. There's a ton of muscles, different muscles here in all of this meat. And so there can be some entrapments anywhere down the chain. I would say from clinical experience, and I'm not sure if Dr. Cook, agrees with this, is that if we don't have a discernible true carpal tunnel here, most likely it is coming from somewhere in your neck.
Yeah, I'd say that's what we typically see too.
Yeah, absolutely. Because there's a lot of complexity in here. Most of us are doing too much shrugging because of our lifestyles and current careers, past careers. And so we have so much tightness in this area that's probably where it's coming from. But that's why Dr. Cook has so much amazing imagery for things that we can't see with our eyes that you can see on an image, and then getting that evaluated and all that stuff just to make sure, right? That was kind of long-winded, but hopefully that answered your question, Craig.
Yeah.
Great. Any other questions? Please feel free. Is carpal tunnel syndrome something long-term? That's a great question. Dr. Cook, you want to take that?
Sure. I mean, if it is true, like if you don't do any treatment, it certainly can be a long-term issue. And how I kind of guide my clients through it is, let's look at the neck and see if there's any issues arising from that, and then fix that problem first. Great. And then also co-managing with the PT to see if maybe doing things like nerve flossing, certain strengthening exercises for the wrist and up the chain, like working, if someone's only looking at your wrist and they're not working up the chain, it may not help to kind of completely solve the problem. So what I've noticed is that most of our clients that are proactive about, checking their neck, working on wrist exercises with their PT, these are things that all can help absolutely manage, so the pain and the sensations are very minimal and livable. You can still work and do the things you need to do, or they might actually completely resolved. We've seen that happen too, just patient dependent. So it doesn't have to be long-term. If you kind of just don't take any action or wait it out, it potentially could get worse. And, you know, some, like Dr. Perry was saying, of course, surgeons are always going to want to do surgery. However, if it is a true, like if you have an injury there, or, you know, you've been typing at a desk for 25 years, there could actually be, you know, surgery may be warranted in some very small, but some cases. And so doing that, I've had patients that did have to end up getting it done. And of course it helped because they had true carpal tunnel. So I think it's just working with the right provider to diagnose exactly what it is and then help you work towards fixing the problem. So it doesn't have to be long-term. It's just figuring out what the severity is and then working with the provider to move forward. Anything you would add, Dr. Perry?
No, I think that was very, very well, amazingly put. Yeah, you know, most of the issues we have within our body, you know, during, you know, a car accident or something catastrophic like that, you know, can be addressed with, you know, musculoskeletal interventions. And by musculoskeletal, I do mean in the neck, upper cervical spine. You know, Mercedes, if I may, you know, we've worked with some of your clients who will remain nameless, but might be on the call right now. You know, who have had you know, significant, you know, forward head, rounded shoulders, things like that, where, you know, in working with you, you know, that stuff was corrected, and so now all these other things are falling into place. Their shoulders don't hurt as much, you know, their upper back doesn't hurt as much, their mid back doesn't hurt as much, you know. So you know, it's just all about making sure you're taking care of yourself and managing, exploring all of your options prior to, you know, a surgery. So
Yes.
and we're just reading the chat here. Do you want to take that, Dr. Cook? Would you like me to?
Sorry, let me pull this up. Okay, Jonathan. Okay, so you just had a cortisone shot done last month. So if you're still, can you just type in the chat if they did they do the injection in the wrist or in the neck? That might help me kind of clarify in the wrist. Okay. Because if it's helping somewhat, but it's not fully resolving, and because of your career being a hairstylist, I take care of a lot of hairstylists. These people work hard. You guys work really hard. And you know, it honestly may be more postural related, Jonathan, because you know, you always have your hands up here and shoulders. So it may be more like working on nerve flossing, and more like posture things because of your career. If they did the injection in the wrist, honestly, it probably is stemming from the neck and the shoulders. So, I mean, because of that, because you're still feeling things, especially after the steroid, I really think getting an evaluation done. I mean, there's certainly things that you can do at home, like looking up nerve flossing, you know, working on rolling back your shoulders, being mindful of your posture. But I would recommend, if you have someone local to you, getting your spine checked or seeing a PT. That way they can evaluate and help you with more of like the upper body stuff. I think that would be really beneficial, especially if you want to keep doing hair for 10 more years. But yeah, I mean, again, because cortisone shots can help, but again, it's just temporary and it's not something that you want to do repeatedly. So having someone else evaluate you and hopefully give you some exercises to help with that, I think will not only help with your wrist, but even help with your upper body while you're making everybody look beautiful. Yeah.
I could definitely use a hairstylist right now. My hair is getting a little unruly. Yeah, I mean, absolutely. And so, if we're just to add into that, yeah, if we're getting these injections here and it's helping a little bit, but then we're going in, cutting hair in all of these different awkward positions, then, I would, guarantee there's some kind of neck involvement. And
Yeah.
if not, possibly what could be happening is that cortisone was a piece of the puzzle, as Dr. Who was alluding to, but not the whole puzzle, which is why you're still experiencing some pain.
Yeah,
So,
and Jonathan, if you can in the chat, if you don't mind sending us your zip code that you're in, Dr. Perry and I can look up maybe some recommendations closer to you that we can have you look into.
absolutely, love to help in any way we can.
Yes.
Yeah. And yeah, speaking of helping, for all those who are in the San Diego area, I don't think I said in the beginning, our office is in Scripps Ranch, and something we don't typically do but are doing here for all of y'all is for those who aren't seeing us, we'd love to offer we're only limiting it to 2 people, a wrist evaluation consultation, where we have you come into our office and we, take a deeper dive into what's going on and what might be going on, because we can see some of your faces through Zoom, but we need to get the full picture, because I guarantee some of us, if they're sitting like that I can't see on here, we can really have some quick interventions to start correcting things. And so this would be a complimentary wrist consultation for only 2 people who are on this call. If you are interested, in that, or would like some more information, please PM me. You can do a private chat. I'd love to have your email, and we can correspond via email.
Awesome. And similar to Matthew, I know a lot of my clients are on this call. If you're not a client and you're questioning if your neck may be a part of this equation and you just want to talk to someone about that and what your options are, I would love to extend the offer to 2 people as well. I would love to have you come into the office, learn a little bit more about upper cervical and how we can evaluate to help you get to the answers that you're looking for. So same thing, if you're interested or want to do a complimentary consultation, just private chat me your email and I will get in touch with you. Did anybody else have any questions for us before we end? Matthew, I actually had one question, because sometimes this is even personally, and I've had some clients as well where when you're in like a push-up position, or your wrist is in that extension and you're putting weight on it, if that's like an area of pain, not necessarily carpal tunnel, but just like pain in the wrist, do you have anything specific that you tell your clients to work on or do you think that's kind of a mobility thing? Any advice on that?
Oh, that's a great question. Yes, absolutely. So I'm just trying to figure out where I want to go with that one. That's a great one. Typically, what I have found is that people who have problems with that typically have just a little bit of difficulty, one with the mobility, but 2 with I call it tissue tolerance. Their ability to handle load, which it would be a push-up, that's load into the wrist, simply and possibly because they just don't do that enough. don't put themselves in those positions. And I'm not, necessarily saying to everybody here, if something hurts, just keep leaning into it. But how we can work on that initially and then progress that is by having someone I have my table here, for instance, in maybe an inclined position where their wrists aren't as put back, in order to kind of start that. And so we'll say a full push-up position for this hypothetical person, or yourself, might be a 6 out of 10 pain, right? If we can decrease it to maybe a 3 out of 10 pain where it's manageable, in that inclined position, I think that's good. And then how we would work with that, with also some other postural re-education stuff and muscle reactivation, is then to slowly kind of lower that position down, okay, to that final full push-up. And we've had a lot of clients get some success with a protocol like that. Another thing you can do in the time being, though, is doing push-ups on your knuckles. So my knuckles are here, and now I'm doing that push-up. That doesn't fix the problem. Our goal is to, as yours is, to always fix the problems. But and I guess instead of the table, you can also start on the wall and then lower yourself down. Again, pretty long-winded, but hopefully that makes sense.
No, that's helpful. Thank you.
Yeah. But some wrist mobility is probably in you and that person's future.
Yep.
I think we have another question in here. Ooh, that's another good question. You guys asked some wonderful questions. So wrist holding during repetitive activities, and particularly excessive paddling. So I'm just trying to think of the motion of paddling. I would probably assume that does a lot of flexion, just like this particular position that we went over earlier. That's actually a test. And so how should we hold our wrists? We always want a little bit of extension in our wrist. And so we'll say if this is 100% neutral in my wrist, a little bit of extension. Okay, our wrists typically naturally do those things, do that when we hold something. If anyone wants to hold, and test that on their own, their wrists will go into a little bit of extension. That's a strong position for our wrist to be in. So if we're doing a lot of things with that hyperflexion, again, I'm kind of thinking paddling might be in that, or even this way, those end ranges our wrist doesn't love to do that often. So another case in point, we're a lot stronger in this position with the slight extension. So if you ever seen the karate movies where someone's holding a knife or something and they bend the wrist down and then take the knife away from them, your muscles actually can't work very well in this position. So now we're relying on our ligaments and some of our passive structures. So hopefully, Kimberly, that does answer that question.
I would just add too, one thing that could be helpful if you are a rower or if you're paddling a lot, and putting pressure down on the wrist. One thing you could do too is look into nerve flossing and some wrist mobility exercises, and do that actually before you do the activity and then after. So you're kind of warming up your wrist. I've noticed a lot it's the same for the neck and the wrist. Nobody thinks about warming that up or doing exercises for it. We just think that these things work by themselves, and they don't need any attention. But I have noticed that if you just do a bit of mobility work before and after some more heavy wrist activities, that could be really helpful too.
That does bring up another question. Is there a way, when I used to work out, I used to stretch out. Is there a way that you can stretch your wrist? Going to what you were both talking about is, moving the wrist and stuff, and then, doing exercise and stuff, is there a way to actually stretch out the wrist like you would stretch out your arms and your legs and stuff, or is that just too compact, or, because it sounds to me like with the paddling, it's been a long time since I've done anything that intensive with my hands and stuff, but I could see where you might get tired from the motion and stuff. But is there a way to maybe just stretch that out to,
Yeah, well, I can tell you, Craig, since I, use my hands and wrists to adjust, and Dr. Perry, you please correct or what I should do. But I like for wrist mobility in the morning, like I'll extend let me see if I can show properly what I'm trying to do. Like I'll extend my wrist and pull back here. So I'll stretch this way, and then I'll do the same thing. I'll just add light pressure here. So I'll just go both ways.
right?
And so I do that. So I do think it is absolutely possible to do some stretching. There might be more, which is kind of more Dr. Perry's thing. But I just do the flexion and extension stretches, and I don't pull very hard. I just press lightly just to kind of feel the muscles, stretch, and then I release.
That was really good. I love that. No corrections at all with that. So yeah, mobility is incredibly important. And then to take, that and add some strengthening components and things like that. I should probably do a little bit more of it too, just because I love all of the engaging questions. We're going to spend some time on this. You can take a water bottle. This is empty. It doesn't have to be anything too light. You can fully extend your wrist like so, and you can do some light wrist curls, okay? And again, this isn't person specific. This is kind of just general wrist exercises to strengthen and work on all of these muscles in your forearm, okay? All the muscles in your forearm pretty much end about right here, and then it becomes tendinous below. So doing something like this, and again, I'm only focusing on the wrist, is good. If you don't have that, you can keep it simple. Do something like this. Give yourself some resistance. My palm is facing me. A little bit of resistance, but let yourself win. Okay, we call this an eccentric muscle contraction. This promotes not only strength, but also length and mobility into the wrist. So again, if you're here, doing that, okay? And the opposite remains true as well for the extensors. Going here, and then resetting and do it. You want control to prime those muscles. So do it slow and methodically.
Yes.
That was a deep dive, but hopefully that.
Ooh, I do have one more thing, because I'm wondering if anybody else is curious about this. But Dr. Perry, do people ever ask you about, have you seen it's like a little rubber band, and there's a hole for each finger, and then you like extend like this? What do you think about those types of things and helping with the wrist?
Absolutely.
Okay.
Again, all of these are tendons down here, so it might not seem like you're doing something, but the tendon is connected to the muscle, right? So if you have the ring over my fingers here, and I do this, I'm working on all of these extensor muscles, which go to the outside of my elbow. And then similarly, if you were to take the ring and flex it. And so that's absolutely perfect. And just because I'm an efficient person, I like, multitasking if possible. You can do, the squeeze of the piece of equipment along with the wrist curl, right? And then vice versa for your extensors, if that makes sense. But yeah, all of that's good. You guys always just want to be training stuff in different ways. I even like the wrist curl or thing. So yes, all movement is good movement. Most movement's good movement.
Yes.
What is nerve flossing? So Mona, that is the what we discussed earlier with this position. Again, that is trying to mobilize the nerve, stretch the nerve, if you will, just like you would a muscle. And since we know everything's connected down to here, we have to extend and stretch the whole system. It might, I should have probably said this earlier, it might feel also like a stretch throughout your forearm, and that'll happen because the nerves are all connected to the muscles anyways. So that's kind of a nerve floss. There's a lot of different interpretations out there, but again, this and this would be kind of that level 1 nerve floss. That answer your question? Great. Well, everyone, really appreciate the engagement. We would always love to hear your feedback. We'd like to do some more of these, and whether it's topics or what you liked, what you might not have liked about our presentation, because we're just trying to help and do more for both our respective clients. So. Any other nerve flossing techniques you can suggest? Okay, we'll do one. Yeah, one more. So this is that median nerve, carpal tunnel. Sorry, Dr. Cook, for keeping you. I can't resist.
Oh no, you're fine. Let's do it.
Great. So this is another one. This is actually for the ulnar nerve. As Dr. Cook said, that median nerve is kind of this distribution. The ulnar nerve is the opposite of that. Okay, so what we can do is think about like a waiter holding a dinner plate, something like that, and we can come in and we could go towards for that floss. Again, my palm is up in the air for those who can't see. You can also tension it like this. I know it's kind of again a funky kind of position, but again, this is how we get to working on the health of our nerves.
Feels great.
Yeah. So now you can grip with superpowers now.
I wish.
One day, perhaps.
Yes.
Well, if there aren't any other questions, this has been a great presentation. I've really enjoyed this, and we want to do more of them. So please give us your feedback. And if you would like to take Dr. Cook or myself up on that limited availability consultation, please reach out to us. You should have the emails and all of that stuff. And I hope everyone has a wonderful evening. And we'll see each other hopefully soon again.
Yes, thank you guys. Have a great night.
All right.
Thanks, everyone.
See you guys soon.
Thank you.